So with that, I would yield, or I reserve, I'm sorry.
Gentlewoman reserves. Gentleman from Oklahoma is recognized.
Thank you very much, Mr. Speaker. Mr. Speaker, I yield 4 minutes to my good friend, fellow member of the Rules Committee, and distinguished member of the Committee on Energy and Commerce, Dr. Burgess of Texas.
The gentleman from Texas is recognized for 4 minutes.
And I thank the gentleman for yielding. Look, you just have to ask yourself, what in the heck is going on here? Doctors across this country, our heroes in the healthcare fight that we've been in the last 2 years, are facing significant cuts in Medicare, in their Medicare reimbursement. Instead of getting a commitment from Congress that we're going to work on solving this problem, what did they get? A gimmicky bill tying a reprieve on the Medicare cuts to the debt limit. It's a dead duck over in the other body. It's not going to pass, and the majority knows it's not going to pass. Why don't we face the facts and get things done correctly from the start? Look, unfortunately, our authorizing committees, the Committee on Energy and Commerce and the Committee on Ways and Means, has not seen fit to hold the hearings that would be necessary to provide a solution to this problem. Our providers need and deserve that certainty. Look, I don't know, Mr. Speaker, what it's like in your part of the state, but in my part of the state, we're experiencing a shortage of healthcare workers. We're also seeing hospital consolidation becoming more and more prevalent. The coming Medicare cuts will only worsen these issues. Furthermore, we've not even considered the cuts due to the Centers for Medicare and Medicaid Services for clinical labor pricing updates. Some studies are now indicating that these cuts could be as significant as 20% for some providers. Many of these same providers serve our seniors. They serve patients in critical care populations, including cancer patients and patients receiving critical surgeries or procedures. Overall, the clinical labor pricing updates will have an extreme impact on health quality, as it will affect our most vulnerable populations. I appreciate the fact that the rebate rule is not included as an offset in this bill. That truly was budgetary smoke and mirrors that had no place in a rational discussion of this. But I do have to ask why we are reluctant to reuse the dollars in the Provider Relief Fund as an offset instead of creating a new Medicare sequester, that won't start until 10 years from now. Mr. Speaker, we're all familiar down here of kicking the can down the road and robbing Peter to pay Paul. We're basically now robbing Peter's grandchildren to pay Paul. The Provider Relief Fund is sitting there waiting to be used. It would provide targeted relief to providers consistent with the original intent of that fund that we all voted for on March 27th of 2020. Unfortunately, this bill includes a one-time procedural change to allow the Senate to originate and pass a debt limit increase with only 51 votes. The Medicare issue and the debt limit do not belong in the same room, let alone in the same bill. Protecting patients' access to care and helping healthcare providers during a public health emergency is a bipartisan issue. It deserves sincere congressional action, and it's time we work on that meaningful payment reform. I thank the gentleman from Oklahoma, and I yield back.
Gentleman from Texas yields back. The gentleman from Oklahoma reserves. The gentlewoman from